It's Wednesday, July 1st, and time for your Barbados Today morning news update. There will be no immediate lockdown of the country if new cases of COVID-19 are recorded when commercial flights resume travel to Barbados. That's according to Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic, who believes the country is much better prepared to deal with any new cases of coronavirus. However, he has admitted that if the island's resources are outstretched due to an influx of cases, authorities will take decisive action.
The COVID pandemic presents us with a three-dimensional threat. One, health. Two, a societal threat to the social impact of COVID. And three, an economic threat. And it is the economic threat that will destabilize our response to the social as well as the health threat. And so that is why we are doing what we are doing, because we are faced with a multi-dimensional problem. As I said to you earlier, going back to the initial stages, we will watch what happens. We know our capacity. If and when we get some cases, that will not trigger a lockdown, as we did not even lock down when we had our first 10, 15 cases.
Meantime, plans for extended opening hours at the David Thompson Health and Social Services Complex are back on track. Minister Bostic gave the update yesterday as he outlined the details on having the St. John Polyclinic open for longer hours. He said the pending arrival of over 100 Ghanaian nurses in the coming weeks would help bolster the staff complement at the Queen Elizabeth Hospital, as well as the district hospitals and polyclinics.
Throughout the last several weeks, and I would say even probably about 2 months or so, we've been in constant contact with authorities in Ghana. I myself had a meeting about a week and a half ago with the Minister of Health of Ghana. They are ready to go. Everything now at our end has been done, and right now we are in the process of through the Queen Elizabeth Hospital of arranging for a flight to bring the nurses from Ghana to Barbados within the next few weeks. And once those nurses have arrived, have done their quarantine and so on, then we will be in a better picture in terms of determining when we will commence the service at St. John Polyclinic. But you would also recall that I did indicate too that we would not go a full 24 hours initially. It will become, first of all, an extended hours clinic, so that the clinic will run 7 days a week and later hours than it currently does.
The imminent closure of regional airline Liat has prompted a call from a former development banker for a private sector-led airline in its place. Dr. Justin Ram, Chief Executive Officer of the securities trading firm GSEC, also wants to see lower taxes on airfare and a single air service agreement for the region.
I think it also leaves a significant opportunity going forward. And I can only hope that the regulators, the policymakers take advantage of that opportunity to look at a new model for aviation in the region. There's a multilateral air services agreement between all CARICOM states that, if it was ratified by all of the countries, would actually allow any airline from any jurisdiction to fly between routes. That is what I think we need to move towards, and to move towards a greater reliance on private sector airlines to service the Caribbean. Now, for them to do that profitably, it means that governments really have to consider lowering the taxes and the fees on air travel. I think that has to be very important. It's time that for the governments to focus more on safety and on regulation.
Approximately 90 dismissed Liat pilots are unhappy about the way they have been treated by the airline recently, and head of the Leeward Islands Airline Pilots Association, Patterson Thompson, told Barbados Today he was concerned that they have not yet been given any indication as to when they are likely to be paid severance and any other monies. On Monday, St. Vincent and the Grenadines Prime Minister Dr. Ralph Gonsalves said the welfare of the airline's staff was a priority, even in light of the challenges faced during the past few months due to COVID-19. However, Thompson believed the pandemic situation may have given rise to a thought process of resetting labor contracts.
But we've been hearing rumors. We know that COVID-19 has a wide-ranging effect on a lot of businesses, and aviation is no different. I do think, however, though, that in our opinion, it may have given rise to a certain thought process of resetting labor contracts that various parts of management felt were too difficult to handle. I think it's an excuse to them. I think everybody never waste a good crisis, and they try to reset the COVID-19, using COVID-19 to reset some of the labor contract. But there's no doubt that COVID-19 had a big effect on the act.
Thompson said the issue of severance was a major concern.
There's a lot of pilots have given their complete adult life to the act. I have Captain Esdale, who is set to retire next year, 42 years. Oh, wow. Captain McDonald, who's set to retire this October, he would have given, I think, 30-odd years to the act. And to tell these gentlemen that they don't have severance, or they may have to take a haircut or cents on the dollar, is difficult and hard to swallow in these times. You know, I have young pilots who have not even passed probation. There were 3 or 4 Grenadians, one Beijing guy, that are suffering. They didn't even pass probation. So, I mean, they're not going to get anything. I have pilots that have families. I have 3 children. You know, so it is you expect after 15 years in the air that you would get some severance. Right. Now, we do understand the issues of a limited liability company, but I think a company owned by 3 governments has a moral obligation to pay severance.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region, the director of the Pan American Health Organization, Dr. Caricia Etienne, tells countries planning to relax public COVID health measures that timing is critical. She also made it clear that countries must take a phased approach based on local conditions and be prepared to impose preventive measures again if the situation changes. The PAHO director said reopening requires public health measures to track new cases and build sufficient capacity to detect and control new outbreaks.
As countries that have controlled the spread of COVID-19 start planning to reopen, timing is going to be very critical. At national or at local level, we must open gradually, taking a phased approach that relies on robust surveillance, data, and expanding testing and contact tracing capacity. We also must be prepared to adjust course quickly if the epidemiological situation changes. If you have the will to relax preventive measures, you must also have the courage to pull back if infections rise. National and local governments must let transmission dynamics establish their timeline for reopening. The goal is to flatten the curve and then bend it downwards significantly before relaxing any restrictions.
And finally, on the international scene, top disease researcher Dr. Anthony Fauci has told the U.S. Senate that he would not be at all surprised if new coronavirus cases in the country reach 100,000 per day. We get more in this report from Reuters TV.
US authorities directly pleaded with Americans on Tuesday to wear masks to help stop the coronavirus. Cases have more than doubled in 14 US states in June, according to Reuters data, including California, Florida, and Texas. Vice President Mike Pence joined US Surgeon General Jerome Adams, who called the mask, quote, an instrument of freedom.
Please, 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 wear a face covering when you go out in public. It is not an inconvenience. It is not a suppression of your freedom. It actually is a vehicle to achieve our goals. It adds to your convenience and your freedom because it allows us to open up more places.
It follows the US top infectious disease expert, Dr. Fauci's dire health warning on Tuesday that if Americans fail to follow health guidelines, new COVID-19 cases could hit 100,000 a day. Officials warn that some Americans, particularly young adults, have recently let down their guard and are socializing without masks on. US Vice President Mike Pence echoed the call, but struck a more upbeat note, praising healthcare workers.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.